The question of this video is whether or not you should be getting an annual, yearly physical health exam from a doctor, right? And there's actually quite a lot of debate on this topic. There is some research that shows that younger, healthier people who are active, there's really no benefit, right? They're not really catching anything prior to it develops. And so some people think it is a waste of money, right? Some doctors think it's a waste of money. However, for other groups, it is going to be very important. So we're going to kind of dissect this and see, whether or not you should be getting an annual health exam. And, if you haven't had one in a while, it's probably not a bad idea to get checked out. So when you do go to your annual health exam, they look at all kinds of things, right? Your history, like your personal history and your family history. They check your vitals, like heart rate and blood pressure, just to make sure those are good. They'll do a heart exam, so they listen to your heart, they listen to your lungs. They'll check all kinds of things with your head and neck. They'll check your ears, they'll check your nasal passages, check your tonsils out, your lymph nodes, which are little ducts that are integrated into our immune system. So you can feel lumps in the armpit if we were sick or something, or around the neck area as well. So they'll check those out. You may remember somebody tapping on your abdomen. This is like testing liver size and different fluid levels in your abdomen, to make sure there's no issues there. We've all probably felt the little hammer that hits your knee. They check your reflexes. This would be that neurological exam. Dermatological exam is like your skin health, right? If you have lots of sunspots, that could become cancerous, right? So that might be something worth checking on. And then they do sex organ exams, right? So for young men, it's typically testicular exams, right? Make sure everything is good there. Maybe a hernia exam as well. Colonoscopies as well. We'll talk about that in a second. And then for women, you get a pap test, or it's basically a pelvic exam, right? Make sure everything is okay down there. For women between the ages of 20 and 29, they recommend having this done every 3 years. And then 30 to 65, they recommend doing it every 5 years. So, and then they can also update your vaccines, make sure everything is good to go there. So it's not a bad idea to get one of these every once in a while. Basically, from what I was reading, a bunch of different doctors' opinions, is that if you are healthy, active, exercising, and eating well, and you don't have any problems, you probably don't need one of these every year. Maybe every 3 to 5 years, just to check up. However, when you're younger, it's more important to get these done because things are developing and things can be caught while we're young when we're developing if they're, going wrong, and maybe we can get ahead of them before they become a problem. However, as we get older, these are going to become more important, as we will see right here. Before that, some people, if we have chronic conditions that tend to increase our risk of disease, they do recommend getting a physical exam every single year. So number one is carrying excess fat mass. Again, we don't use the terms properly, right? Overweight is what they use, but really we're talking about carrying excess fat mass, which is dangerous, right? Your weight doesn't necessarily matter, but carrying too much fat mass does bring lots of risks like diabetes, hypertension, cardiac disease, right? And so it's good to be checked out for those things. If you have a family history of diabetes, right, that would be a good thing to be checked out for. I have a family history of diabetes, so I actually really need to go in. And it's called an A1C test. They can do different blood tests to just make sure that you're not developing diabetes. So I need to go get that done within the next year. And now they're recommending if you're just over the age of 40, regardless of family history, or 45, you should probably be getting an annual exam to be checked out for diabetes. If you're on any medications, sometimes if you improve your health, you can get off of these. So they recommend medications for migraines, high blood pressure, and diabetes. You should get an annual exam. And then different cancer screenings, right? So mammograms are screening for breast cancer. You can learn how to do this yourself. Same with testicular cancer. Men, you can learn to do this for yourself. Around the age of 45, it's good to start getting those screenings done. And then for a colonoscopy, this would be for colon cancer, right? Around the age of 45 to 50, there's some debate about that, of when that should be occurring. There might be new tests where you don't need to go into the doctor to get this done, like stool samples, for example. So those are some reasons to go get exams. So about the age of 40, 45, we want to start for sure getting exams. Unless we have underlying issues while we're younger, then it's still probably a good idea to get a yearly exam. With this said, before I go here, the ACA actually has mandated that everybody gets a free yearly exam. So if you have health insurance, then you can go ahead and get checked out once a year for free. So that's not a bad thing right there. Some other maintenance things. For eye exams, when you're young, they do it fairly frequently. As you get older, they suggest every 2 or 3 years. If you have any problems with clouding or blurry vision or little floaty things in your eyes, that might be a good idea to go get that checked out. For skin checks, if you have a history with melanoma, which is skin cancer, they recommend doing that once a year because they can just cut out the little cancerous spot and then you're good to go. If that metastasizes and spreads, cancer is not a fun thing to deal with. And then for dental exams, they recommend every 1 to 2 years. If you have dental health insurance, which you can get through the ACA as well, you get 2 free cleanings per year. So I've been doing that, and I think it's a good idea to not neglect your teeth because there is some correlation between gum disease and heart disease, and whether or not the gum disease causes heart disease or they both seem to occur from the same process is not exactly clear, but it does seem to suggest that the better we take care of our oral hygiene, the better our health will be long term. So, all right, that is good for this video. You're going to think about how you can use how you can use annual exams in your daily life for this assignment. I will see you in the next video.